And Cape York Aboriginal communities have among the nation's highest rates of chronic disease. High sugar diets, smoking, drinking and a lack of exercise mean many of the region's Indigenous residents are dying relatively young. But it's hoped a new community-controlled health centre at Kowanyama will help turn poor health around. Kirsty Nancaro reports.
This is the sound of the next generation. Unlike her previous pregnancies, Lavina Inkerman can now receive her maternity care in a setting designed for her cultural needs.
Having our own place here, it's really great for all the family and benefit the community.
I really believe that it will have more people going through the door.
It's hoped this new facility at Kowanyama on Western Cape York will be the front line in tackling chronic disease.
Cardiovascular disease is the main killer, so diabetes contributes to that if it's poorly controlled. So huge burden. It's probably going to get greater in the future unless we start intervening now and doing the right things.
The Apunipima Cape York Health Council is aiming to change that through programs including cooking classes and men's health, and the community will have direct input.
I just see it's a great asset for the health of Kowanyama because it's introducing a lot of stuff that we can't do over at the clinic.
Government always talk about closing the gap. We'll start closing the gap on the ground here ourselves and showing them that we do mean business and we want to go forward.
This facility is the first of its kind in Cape York. It's hoped the federal government will invest more in this type of infrastructure to reduce the burden of chronic disease on hospitals in places like Cairns.
The centre will be open for business on Monday. Kirsty Nancaro, ABC News, Kowanyama.